There you go. So hello and welcome everyone. Today is September 16 and I welcome you to a new community chat. The community chat of this week is going to talk about patient experience and how we can feel, I will say, at home when we're in the hospital, even though nobody feels at home really, and especially when you're sick. But the Montefiore Nyack Hospital Patient Experience Department is really trying their best to give you a very homey experience. And today we're going to talk to the Director of Patient Experience, Kristen De Lorenzo, who's going to tell us about all the things that Montefiore Nyack Hospital is doing in their department to make sure that everybody's happy when they are here. Not that we like everybody to come, because we don't like to see sick people. As we like saying that, like, as much as we work in healthcare, we prefer that people are healthy and stay home and they don't have to come here. And that's the reason why when they have to come, we try to do our best so that everybody feels comfortable and, and safe. So Kristen, welcome. I'm very happy that you're here. I know that your department works really, really hard. So I'm glad that you can share with everyone today what you're doing and all these initiatives that you're putting together.
Yes, thank you, Sandra.
And before we get started on the meat and bones of this talk, I would like to learn a little bit about you. Like, how did you get to work in Montefiore Nyack and in patient experience in particular?
Sure. So like Sandra said, I'm Kristen De Lorenzo. I'm the Director of Patient Experience here at Montefiore Nyack. I've been here for 7 years. I started at Montefiore Nyack as a patient experience representative and then was able to work my way up within the department. My background is I have a master's in healthcare management, and initially after getting my bachelor's in biology, I was thinking I wanted to go the clinical route. So I became an EMT and I thought maybe PA or MP was the way I wanted to go. After being an EMT for a bit, I realized the clinical and ooey gooey bloody was not for me, but I still loved interacting with patients and families and wanted to be able to work in healthcare and have a meaningful impact in a different way. Hence why I went the healthcare management route, and patient experience really, helps me feel really fulfilled and that I'm able to make a positive impact, but just not necessarily on the clinical end.
Mm-hmm. It's interesting. I share a similar story. That's why I became a dietitian, because I wanted to be in healthcare, but the same thing, blood and all of those things wasn't for me. So I chose dietetics because, working with food is definitely a lot cleaner. So that's funny. So tell us a little bit about what patient experience is.
Sure. So patient experience is really the sum of all the interactions that a patient or a family has and the perceptions that they leave with throughout their healthcare experience here in the hospital.
Mm-hmm. And what is the structure of the department?
So there's myself, the director of the department. We have a manager of the department as well. Her name is Katie. So from a leadership perspective, the patient experience, myself and Katie are really responsible for looking at our patient satisfaction data, which I know we'll get into a little bit later as well. And we track and trend feedback, both positive and negative, that we hear from patients and families and community members, and then work with our multidisciplinary teams to develop patient improvement and quality improvement initiatives. Within our department, we also have 2 patient experience representatives, Jada and Nicole, and their goals and most of their workday is really centered around proactively rounding on patients and families. So whether that's on the emergency department side, inpatient, ambulatory surgery, wherever the need is, we're proactively there speaking to patients and families, inquiring about their healthcare experience and their visit here in the hospital, anything from, walking into the organization as a visitor or making their way through the emergency department and transitioning up to the admission and inpatient side, inquiring about their, meals, the cleanliness of their room, the structure of their room. Are there things that are not in the room that they would like, as we look to continue to enhance our facilities. Communication about nursing and physicians is always a big topic, but really just learning from the patient and family experience and seeing what we can do to help facilitate any requests or communication. And then we also have two new employees within our department, Trish and Dory. They are part of a pilot program we're in the middle of right now. They are patient and family ambassadors. So they're nurses, and they came out of retirement during COVID to help us in the middle of the pandemic, and then stayed on board with us. And we've been very fortunate to have them participate in this pilot. And as nursing members of our department, their role is more clinical based. And they are currently focused on 2 medical surgical units, and they are focused on being an extra point of contact for our patients and families and reinforcing patient education and any patient experience initiatives.
So tell us a little bit more about this rounding. How does that happen, and how do you select which departments to round or which patients to round? What's the process?
So our goal is to really touch on every patient at least once during their hospital admission for the inpatient side. And, that can be upwards of 200 patients. We like to at least touch base with them once. We try to have consistency. So the team members within the patient experience department will typically, pick a unit for that day, the next day, and then try to maintain consistency and developing relationships with those patients and families day after day. And then when it comes to the emergency department, we typically stop in there in the morning, as that's when the census tends to be a bit higher. And then again, one time in the evening. And then as the other service lines within the organization, outpatient and ambulatory surgery, those visits tend to be, quicker. They tend to be in and out, but we're always there and speak to those leaders as well to see if there's anything that we can do and continue to gather feedback and other methods for those quicker visits.
And I guess you do that in person, right? Like you just go to a room and you talk to patients and their visitors as well?
Yeah, we go into the room, knock on the door, introduce ourselves, obviously pay attention to body contact, to body language, if that's, the right time to talk. If a patient's, not feeling well or is in pain or in discomfort, we would come back, but certainly leave our business card, let them know that our department is here, that we exist. We're here to help them in any way possible. Nothing is outside of our scope, really. And, we'll hear from them either by phone, they'll ask us to come back, or we'll touch base with them a little later.
Are there any initiatives that you have started to make the experience for the patient even better? Yeah,
definitely. So from the feedback that we hear from our proactive rounding, as well as our survey process, we can identify areas that we're doing really well in, and we always highlight those areas, either whether that's a particular unit in the hospital, a service line, or even on an individual level. And we'll work with our human resources department. They have a rewards and recognition program where the individual, their unit are highlighted based on the service and the performance that they provide our patients and families. But then at the same time, we're also able to gauge areas of opportunity from the feedback we hear from our patients and families. So is there, an area of the hospital or a component of their hospital stay that they feel we could have done better on? And we try to ask specific open-ended questions to gather as much information as possible, and then work with those multidisciplinary teams to improve and come up with initiatives to focus on that area.
I understand there is also a survey that you send out in order to gather similar information.
Yes, so the Montefiore system works with a vendor called Pressganey, and that's a national vendor related to patient satisfaction survey and feedback. And we send out surveys via mail, email, and newly text message. So our patients are randomly selected by this vendor. They receive a survey based on the service line that they came here for care, and then they can complete the survey. They can either identify themselves on the survey or remain anonymous. And we try to encourage as much feedback as possible and for as many patients and families to complete that survey, because the more we know things that we're doing well on and areas that we need to focus on.
And then there are other programs that you guys have implemented as well, like, for example, the medication cards.
Yes. So we have a lot of patient education initiatives that we've worked on with our clinical team members and teammates. And that's really a big focus of our patient and family ambassadors as well, and something that we focus on when we attend unit specific huddles and staff meetings. So we have medication education cards, we have signs and symptoms information, we have patient folders, and the purpose of these three initiatives in particular is to ensure that our patients and families feel confident in continuing the care that they need as an outpatient after their discharge from the hospital.
Tell us a little bit more about the medication cards.
Sure. So we have several different medication cards that are separated by medication class, and we worked with our pharmacy team members to develop these. And for example, we have blood thinners and we have them color coded. So the border of the blood thinners is red. So it's, easily identifiable to both our staff and our patients and families. And it talks about what is a blood thinner, what's the purpose and why is it used, what are potential side effects of that medication as well, what are the generic names. And it's really about communicating with our patients and families new medications that they may be prescribed while they're here in the hospital.
Mm-hmm. And what are the sign and symptoms cards?
So we looked at our top diagnoses of patients that are admitted here in the hospital. So whether it's pneumonia or congestive heart failure or COPD or stroke, anything like that. And we came up with signs and symptoms cards, which help our patients have a better understanding of what their diagnosis was and what are things that they really need to keep an eye on, continuing with their transition home or to the next level of care.
Mm-hmm. And what do the patient folders contain?
So the patient folders are really a good tool to hold all of this information. So when you leave the hospital, the goal is that you'll have medication cards to really help reinforce what were the new medications you were prescribed in the hospital, the reason for it, and potential side effects. The signs and symptoms. So what was my diagnosis? And, let me make sure I have a good understanding of that and have a resource to use after discharge. And then the folder really helps compile all of that together. And then there's a nice checklist on the top of the folder, on the cover, so that, we make sure that we touched on all of these things at the time of your discharge, really reinforced it to make sure that when you go home, all of this information, you're comfortable, who to call if you have a question that comes up. You're printed an after visit summary, which is reviewed by the nurse at the time of discharge as well. So it's really a nice tool to be able to leave the hospital and then take with you when you follow up with your primary care provider.
And thank you, Kristen. And at this point, I'd like to remind our participants that if you have any questions regarding this topic, or you would like to just share any experiences with us, just please use the chat box or the Q&A boxes. And I'll be happy to read those questions to Kristen and get you the answers. Lastly, on that same topic, Kristen, the TVs. Every room has like a TV, and I know that you've worked hard trying to get a programming that is like really good and educational and relaxing.
Yeah, so we have patient televisions that are available in all of our rooms, and there are menu options on there. Not only is it for entertainment purposes, but educational purposes. So there's videos about, specific diagnoses. There's videos specific to particular units in the hospital. So mother baby, for example, there's videos there about, breastfeeding and taking a baby home and preparing for that. There's also relaxation channels on the TV as well. So we know it can be difficult to get rest when you're here in the hospital, with phlebotomy needing to come in and take your labs and the staff needing to do vital signs. And while those are all necessary things as part of your care, we also in turn realize and identify that rest is also a vital part of your recovery as well. So based on feedback that we've heard from patients, both from real-time rounding as well as from the survey, we identified that maintaining a quiet environment is something that's really important to our patients. So we've included on our TVs relaxation videos. So it has some nice imagery, whether that's underwater, and it has nice calming music, as well as some white noise. That was something that was newly implemented because a patient had mentioned that they use a white noise machine sound at home to sleep, and we didn't have that here in the hospital. And I can relate to that. And I don't, you do this every day, and it's kind of like you don't really realize it, but I use a white noise machine at home too, and I wouldn't be able to sleep well without it either. So we instituted that on our TV. So now all of our patients that want that can easily access it using their remote.
Mm-hmm. Switching gears a little bit, how do you measure patient satisfaction?
So from the, from the proactive rounding that we talked about, from the survey, so for our inpatient survey, for example, there are key areas and sections of that survey. They talk about communication with nurses, communication with physicians, communication about your medications, your transition home and your comfort with that, the environment, whether it's the cleanliness of the room, the quietness, ask questions about food service. So we gather all that information from Press Ganey, and then we analyze that based on the service line and then break it down to particular units as well. And then from there, we're able to, again, identify, our successes and our opportunities. We share that with hospital leadership, with leadership of the units, with the frontline staff. And then, based on feedback that we hear from patients real time, if there's concerns that they have, we look into those further. We have a complaint and a grievance process that we follow. We track and trend those complaints as well, so we can identify, trends and come up with action plans to mitigate that.
Mm-hmm. And how is the patient feedback shared with the department?
So we have several different committees, which are all held via Zoom right now because of COVID, of course. But we share feedback there. We share feedback, in real time with staff members. So if a patient, recognized the nurse that really went above and beyond, or the physician that cared for them, we let the patient know that we will escalate it to leadership, which we always do, senior leadership of that unit, and then most importantly, to that staff member that's being recognized.
Mm-hmm.
We have bulletin boards on the unit as well that we post things to. Mm-hmm. So we're very transparent with the feedback and the data that we receive.
Good and bad.
Yes. Yeah.
And if someone isn't happy at the hospital for whatever reason, mm-hmm. what do they have to do to feel better? How can your department help?
Sure. So we want to hear if you're unhappy. We want to hear if you're happy, and we want to hear if you're unhappy too, because that's the only way that we can improve is, the more we know, the better. So the patient experience department is currently here 7 days a week. So we're always available. We're typically here about 7 a.m. to 7 p.m. We can be reached at extension 6778 at any time. If we're not here in the building, you can leave us a message, or nursing supervision is here during the off shifts as well. Or you can also always email us. We're available at patientrelations@montefiorenyack.org.
And that's not just for patients, right? It could be family members, because I'm thinking if I have a family member in the ICU, mm-hmm. the patient might not be able to reach out to you, but someone else might.
Absolutely. We get emails, calls from patients, from families, from, near and far family members, from community members. We can really help guide you and facilitate communication or requests for any way in the hospital.
Mm-hmm. And do you have any suggestions for people? I mean, usually when you come to this hospital, you come through the ER, and if you're coming through the ER, obviously you don't have any time to prep. It's not like, oh, I'm feeling sick, let me pack my bag and my favorite pillow, Right. But what do you suggest once you get admitted? Like maybe you can have a family member or a friend or something bringing you things. Just how can you make it more pleasurable for you to stay in the hospital? Because it's already bad to start with. So
right.
How can we help our friend or our family member have a better experience?
Well, I think one of the biggest things coming into the emergency department, obviously, it's an emergent situation, but being aware of what medications you're taking. That's always a big key thing that the clinical staff in the emergency room wants to know. So having that information in your wallet or stored in your phone, whatever is most convenient for you, but, having information about your primary care provider, really background and medical history is important at that point. Mm-hmm. Once you're admitted, we really suggest less is more to stay in the hospital, but, comfort items, we certainly encourage, family visits is always a big thing. And, within the last year and a half, we've had a lot of visitation guidelines as a result of the Department of Health COVID structure. So we were fortunate enough last year, we received many donations from community members and organizations of iPads. And we were able to facilitate FaceTime and Zoom calls with families, that were local or that lived, in other countries even, that wanted to be here with their loved one. And we still do that even today with, having our visitation much more open than it was a year ago at this time. So that's another comfort item that, we always offer to our patients and families. But really, keep as much stuff home as you can. You don't need to necessarily have jewelry here in the hospital. The more you can send home with your patient representative, the better. We have, toiletries for you. So you don't need shampoo or body wash or toothbrush, toothpaste, any of that. Certainly if, you have your favorites at home, then bring them in.
Mm-hmm. Are they hypoallergenic? Just
yes, they are.
People might like.
They're not scented, so
Okay.
They're good for everyone. So if you have a favorite scent, bring your own.
I started thinking about that, and I had another question coming, and now I forgot. But in the meantime, while it comes back to me, one of our attendees would like to know that for patients whose English is not the first language, how can they access the medical education cards that you were talking about and these other tools?
Sure. So good question. The patient education information is available in both English and Spanish. Spanish is our number 2 language here in the hospital. So we always make sure that any information that we're providing is available in writing in Spanish as well. So it's double-sided English and Spanish. For those patients or families that have a preferred language outside of English or Spanish, we have a vendor called Syracom, which we're able to translate written documents through, as well as provide spoken translation. So we have phones here in the hospital, and then we also have video translation using some of our iPad devices. So we can get a translator from hundreds of different languages on either the phone or through the iPad.
Mm-hmm. And Kristen, I think that there is something else that you guys do that I find is very important, both on a professional, but also on a personal level. And it's the What Matters to You.
Yes. So What Matters to You was a huge organizational initiative. Going back a couple of years, we started it and we continue it on a daily basis. So What Matters to You is all about finding out something personal about our patient. Something that, is a goal of theirs, or what's most important to them while they're here in the hospital, but also in their own personal life, because we know that what's most important to them personally really has a huge impact to their stay here in the hospital, whether that's just feeling at ease or maybe their compliance with medications or, remaining here in the hospital. A quick story is we recently had a patient who wanted to leave the hospital against medical advice. She was very anxious to get home, and we kept asking her, why did she want to go home so badly? The clinical team really did not encourage that. It really was a great health risk for her to leave. She wasn't ready to leave. And in speaking to her further, we learned that she was very attached to her cats at home. And she was very concerned for them, who was going to feed them, who was going to be taking care of them. So we were able to help. We were able to learn that what was most important to her were her cats at home, and making sure that they were, well cared for, so that in turn she could stay here in the hospital and be cared for herself. So we were able to team up with her neighbor and have them make sure that they were able to feed those cats. And then we also had another situation recently with a patient, and pets and food are a big priority for our patients in their personal life. Pets, food, and their family are probably the big 3 top topics that we hear. We had a patient who had a psychiatric history and was having a really tough time being here in the hospital. And one thing that we learned from her when we asked what was most important to you at home, it was her turtle. And she found a lot of comfort and peace in seeing her turtle. So we coordinated with her family to FaceTime this turtle. So she was able to, she couldn't physically see the turtle in person, but we were able to coordinate this video call with the turtle, and it did wonders for her plan of care. She was much more compliant. It helped her, it helped the staff better care for her.
And I think those are the kind of stories that make things really unbelievable. For example, I've heard of a couple of stories that your department has done, and it's really amazing how you guys do that and take the time to find out what people really are about and go above and beyond to please people, not just from the point of view of healthcare, but also from the point of view of, you know, their personal care and what really matters to them, right?
Yeah, definitely. And, we've had situations where, patients aren't doing well health-wise and, time is of the essence and limited. So, we try to make that moment special for our patients and families as well. So, what is your favorite food? What would you love to eat? If you're not eating a lot and your appetite is low, like what can we get you? What can we order you from the outside? We've done that numerous times as well. And our families as well, we rely on them. So if we have a patient who are nonverbal, we ask the families, what can you tell us a little bit about them? We want to get to know, their history, at a different phase in their life, or can you tell us things that are really important to them? What do they like to watch on TV? So we can make sure that they can always hear that.
Mm-hmm. And continuing with that talk about food, and of course, to me, that's very important as a dietitian. So not every time that you come to the hospital is for a bad thing. You could come here to get healthier, obviously, also to have a baby. And I know that you have some celebratory meals.
Yes. So we have these celebratory meals for our new moms on mother baby, as well as our elective joint patients that chose to come to Montefiore Nyack for a new hip or knee. So for both of those occasions, and then we also use them for, birthday celebrations or anniversary celebrations. Of course, this is all in compliance with the physician recommendation for their diet and making sure they don't have any restrictions. But our celebratory meals are lovely. Our food service department prepares them on a lovely table with a tablecloth. They get sparkling cider with a nice Montefiore Nyack label on it. And you have your options of filet mignon and lobster tail. There's lobster raviolis on there. There's a vegetation, there's a vegan.
Oh, vegan choice.
There's vegan choices. There's kosher choices, gluten-free. We really try to touch on all dietary restrictions.
Mm-hmm. And here is another question from one of our attendees. How are we helping the disabled and special needs patients?
Good question. So we work closely with a lot of community organizations that we care for a lot of, of their residents. ARC is one of them that we have a close relationship with. But any of our disabled or special need patients, we try to identify what that disability or that need is early on in the hospitalization, and then work with our case management, our nursing team to see, what the need is. One example is if a patient has a physical disability and is unable to utilize the call bell, we have specialty call bells. So whether that's the patient uses that to, tap the call bell with their head or with their elbow, or they breathe into a device that alerts the call bell.
Mm-hmm. And I have to say, because Kristen, you and I have joined some of these meetings with the ARC people, that I think that something that is great is that we don't have the expertise on everything. We will be supermen and superwomen if we did. And however, when we get people with disabilities or special needs, like people really take the time to reach out to these community programs to learn more about this disability, to be able to better help the patient and look for the resources that we need to implement here to look for those, to look after those patients. And for example, also with the sign language, right? Do you want to talk a little bit about that?
Sure. Yeah. So we also have a pretty large deaf community that comes here to the hospital as well. So we have sign language, in-person sign language interpretation available through one of our community local vendors, and they're wonderful. They're here normally within 20 minutes of their request. We try to plan in advance, of course, for any outpatient appointments. But of course, emergencies happen, people show up, and we make sure that we have the video translation for sign language available 24/7. But then upon request and, based on the need, we're certainly able to get in-person interpretation in as well.
Yeah, so that was a great question, because thank you, Olivia, for that question, because that allowed Kristen and I to talk a little bit about that as well.
Yes,
Well,
thank you.
I don't have any further questions. I don't know if any of our participants do, but while they decide if they do, what will be your further thoughts, Kristen, about everything that you're doing, which I think is really great. I've always said I admire your department so much because I see how hard you work and how patient you are, and in really trying to help everyone, again, at that health level, but also at that personal level, and you go above and beyond, and you have many people coming to you with, you know, positive, sometimes negative feedback. And however, you always have a smile on your face. You always manage to be, you know, very patient and very nice to everybody, which I admire so much, I have to say, because, you know, I have to realize when we're not feeling well, we're cranky and we're not nice and we just want to get out of here. And however, you know, you manage everything so well. So
I appreciate that. Thank you. No, my team definitely appreciates that. You know, we work really hard as an organization. We certainly identify that there are things we're doing really well in and things that we need to focus a bit more. So, you know, what we would really ask of the community is to keep the lines of communication open. You know, we love to hear all feedback, good and bad, you know, whether you think it's small or big, you know, every component of the healthcare experience is so important. And we know that. And we know that you're really most of the time in a very fragile state when you're coming here to the hospital and vulnerable. And we don't take the feedback personally. You know, we want to know what the organization is doing well in and things that we can do better. And we want to hear from you.
Mm-hmm. Well, thank you so much. I don't see any other questions from our attendees. So, Kristen, of course, thank you so much. I know you guys are so busy in your department and you took time to be with me today. So thank you so much. And thank you to all of our attendees for joining us again. I hope, and you know that you can always reach me by email if you have any further questions. And also, I'm going to be sending the link with the recording so that you guys can watch it later or share it with people that you feel that this information will be good for. Anyway, we'll keep you posted next week how to keep a healthy brain or a healthy mind. Anyway, we're going to be talking about what exercises to do and everything in order to be mentally healthy. So we'll see you next week. Thank you so much.
Thanks, everyone.